Good afternoon. My name is Janet North, and I'll be talking about the Not on Tobacco program. So, between 2005 and 2009, 480,317 was the annual rate of cigarette smoking related mortalities, and it remains the single largest preventable cause of death and disease in the United States. Many tobacco users began experimenting during their adolescence and continued into adulthood with the addiction. The Center for Disease Control, or CDC, reports that by the age of 18, 9 out of 10 cigarette smokers had tried smoking, and 99% first tried smoking by the age of 26. The daily rate of cigarette smoking initiation in the United States is more than 3,200 for youth aged 18 years or younger, with an additional 2,100 youth becoming habitual cigarette smokers. The CDC warns that if the pace of young smokers continues at this rate in the United States, 5.6 million of today's Americans younger than 18 will die early from a smoking related illness. With these high rates of preventable tobacco related deaths, prevention efforts naturally should begin with the youth. The evidence based program NOT, an innovative program geared to help teenagers quit smoking, was developed through a collaboration between West Virginia University Centers for Public Health Research and Training, the West Virginia State Health and Education Departments, the Coalition for Tobacco-Free West Virginia, and the American Lung Association. This program consists of 10 50-minute, teen-friendly, small same-sex groups which consist of 10 to 12 teenagers. The groups are led by same-sex facilitators who discuss various types of topics such as motivation, stress management, the effects of smoking, preparing to quit, relapse prevention, dealing with peer pressure, media awareness, support networks, and healthy lifestyles. Additionally, 4 optional booster sessions were offered at the conclusion of the program. The goals of NOT were to determine if the program would be effective in decreased youth smoking, increased smoking cessation, prove to be sustainable across diverse settings, and recognized by the National Registry of Effective Programs in order to become a model program that can be used across the nation. High school students between the ages of 14 and 19 in the United States are the target population for the NOT program, and from 1997 to 2002, the program was evaluated in 6 arduous studies in West Virginia, Florida, and North Carolina. Now, the selected target population offers a vast amount of variables. The Surgeon General's 1994 report discussing the prevention of tobacco use among youth and young adults suggests the following psychosocial risk factors that influence the initiation of tobacco use, all of which had an impact on the effectiveness of the NOT program. And they are socio-demographic factors, environmental factors, behavioral factors, personal factors, and current behavior relative to tobacco. The program appealed to diverse perspectives. For example, under the socio-demographic factors, gender was addressed by making groups gender specific with same-sex facilitators, because some things can be openly discussed in this type of setting versus mixed gender groups. The socioeconomic status of the community or county of the school locale and the type of community in which the school was located, that would be rural versus suburban, was also considered by the selection of the diverse Appalachian region. It seems that lower income and rural areas revealed that the rate of cessation was lower than higher income and suburban areas. The environmental factors were considered by looking at the student population size and the student-teacher ratio, the geographic location, and discussing dealing with peer pressure and media awareness. Behavioral factors were observed by conducting the sessions in school settings where organic conversation about aspirations would likely take place, along with risk-taking characteristics and lifestyle factors such as diet, sleep, and proper exercise. Personal factors and current behaviors relative to tobacco were also addressed via discussions about stress and stress management, the effects of smoking, preparing to quit, relapse prevention, and support networks. In an attempt to reach some subgroups, Knott states translation of materials into Spanish is increasing the program's reach, as will a culturally appropriate version for American Indian youth is underway. Now, since 1999, more than 100,000 teens in 48 states have participated in the Knott program. The assumption is that approximately 1 out of every 6 participants quit smoking based on the demonstrated effectiveness of this 4-year program. Peer review by an independent group of scientists further validated the efficacy of the Knott program. It was due to this validation that the National Registry of Effective Programs included Knott in its repository of science-based programs, and the Substance Abuse and Mental Health Services Administration recognized Knott as a model program. The resulting impact of the recognition helped to make Knott more available to teenagers in need.